Hi, and welcome to another edition of Your Health with Dr. Christy. Today we're going to talk about how and when you should test for COVID-19 during the holidays, as we're all gathering with loved ones for Christmas and New Year's Eve celebrations. The idea for this segment came directly from a Wall Street Journal article I read on December 22nd. Journalist Betsy Morris did an excellent job explaining the facts and nuances of testing, and I'd like to share those with you today. The first situation in which you should test yourself is when you have symptoms. The most common symptoms we're seeing these days with COVID are sore throat, cough, runny nose, and fever. And for those of you with symptoms, an over-the-counter rapid antigen test is fine. I personally like the Binax Now rapid antigen test, and I've provided a review of several other over-the-counter tests in a prior video. With the Binax Now test kit, you get 2 COVID tests for about $25, and the results are available in 15 minutes. You certainly can get a PCR test that's offered through a doctor's office or testing center, but realize that you will likely have to wait hours or even days to get your result back, and these tests are a lot more expensive. The next situation in which you should consider testing is when you know you've been exposed to someone with COVID-19 during their infectious period, which includes the 48 hours prior to their positive test or 48 hours prior to when their symptoms started, especially if you've been in an enclosed space without masks for an extended period of time. Of course, if you have symptoms already, test immediately with a rapid antigen test. If you don't have symptoms, wait about 3 to 5 days and perform a rapid test on yourself. This can help you to know if you have enough SARS-CoV-2 virus circulating in your system to spread COVID to someone else. If you're a negative initially and you want to be extra cautious, you can repeat the rapid antigen test a day or so later, which is why the Binax Now test kit includes 2 tests. However, if your initial antigen test is negative and you want a more sensitive test, you can get a PCR test. But remember, realize that you're going to have to wait for results to come back, and you'll pay more for the test, but you certainly will not have to repeat it if it's negative. One reminder is that if you have received 2 vaccination shots and it's 2 weeks since your second dose, you do not have to quarantine after exposure. Just wear a mask until you get your negative test result. The next potential testing situation is during the holidays, or really any time you're going to gather with someone who's more vulnerable or who you want to protect. Someone such as an elderly parent or a grandparent, or someone that's immunocompromised or someone that's not vaccinated, and especially if extended time will be spent with them together indoors. I still would recommend using a rapid antigen test, but do the testing immediately before the gathering. This test lets you know in 15 minutes if you are currently contagious with COVID. Realize that if you're at the start of a COVID infection, you may not have enough viral load yet to trigger a positive rapid antigen test. So testing every few days could be helpful to provide reassurance if you're going to be spending several days with loved ones that are vulnerable. Another way to approach this would be to get a PCR test a few days before your gathering. But you have to be careful with the timing, since it may take a few days to get the result. And of course, during the waiting period, just be sure that you don't put yourself in a situation where you could be exposed after your PCR test has been collected. The final situation when you may need to test is for international travel. The guidelines are constantly changing, so be sure to go to cdc.gov for information about coming into the United States from another country. And you'll also need to find out the specific requirements of the country that you're visiting. At this time, many countries are requiring PCR testing to be done before they will allow you in. But as of now, the U.S. is allowing rapid antigen testing to be done for anyone returning to the U.S. from another country. But you have to have documentation provided by a physician or testing center showing that your test is negative. You can't just bring them your home test and show it to them. At the end of the day, think of rapid antigen tests as, quote, contagiousness tests. They're available over the counter with results in 15 minutes. They're relatively inexpensive at about $25 for 2 tests, and it's my understanding that starting in January, your health insurance may start to reimburse you for this testing. PCR testing is much more sensitive, must be done through a lab, takes longer, and is more expensive. I hope this information can help y'all determine which tests you will need. Thanks for joining me.